Om Dhanvantare Namaha. A warm welcome to all Vaidyas present here. And I am welcoming once again to today's speakers. And I am Dr. Geeta Puttur. I am hosting today's 46th webinar series on behalf of RAAOUS. Today's topic will be very interesting and most needed topic in our day-to-day practice and as well as in our personal life also. So it will be very exciting topic. I think once again we are welcoming both the doctors, Dr. Archana and Dr. Rekha ma'am. Once again, welcome ma'am. Okay, and today it is we are having some time to take the questionnaires in the end of the session. So those who are having the queries, they can post the queries in the chat box. Post presentation, we can take over that questionnaires. So before starting the session, I request everyone to mute the gadgets to avoid the interruption in between the session. So we'll start the topic with the prayer by Dr. Vishwanath sir. Vishwanath sir.
Namaste, madam. Namaste, all. Can I start, madam?
Yes, sir.
ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामयविनाशनाय मृतात्मने त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः. After this, I'll just chant one more shloka related to Agni. Since everything is cornered around Agni, and Agni is a vesture of health for everyone, we know that very clearly. So this is from Rigveda. ॐ अग्निमीळे पुरोहितं यज्ञस्य देवमृत्विजं होतारं रत्नधातमम्. ॐ शान्तिः शान्तिः शान्तिः. हरिः ॐ तत्सत्. श्रीकृष्णार्पणमस्तु. Thank you all.
Thank you, sir. Now I request Dr. Shakuntala madam to speak about our RAAOUS once again.
Good afternoon,
Welcome,
everyone.
ma'am.
Thank you, Dr. Geeta. Om Shri Dhanvantare Namaha. Thank you, Vishwanath sir, for today's prayer. Something special, which is directly related to today's topic. I welcome Dr. Archana and Dr. Rekha ma'am for today's wonderful session. And I thank really and welcome back because 15 days back they have really made a difference within 2 months how to whether the Ayurveda can cure. They have given the answer within 2 months. It can be with the reports they have done the documentation also. So wonderful presentation you have done. We are actually eager to see your next presentation. Not to take much more about the introduction, we know all. RAAOUS is Rudra Arbuda, Ayurveda approach and one shelter. As we are doing so many works under RAAOUS team, we are doing awareness programs, screening camps, we are doing rasashalas, like we are preparing our own medicines, and we are doing educational trips also. And we are conducting 2 classes every week, like one is especially on yoga and second one is on Thursday, especially on cancer. That covers a KC topic in that Thursday topic. Like that we are doing, and we are supporting each other. And like this, like we have RAAOUS team has a built up bridge in between the groups, like the Vaidyas, I can say. So with the confidence, we can treat, we can approach other Vaidyas. So that bonding happened, like family it is going on with Dhanvantari Krupa, I can say. So I really welcome all of you delegates wholeheartedly once again to the second part of the seminar from the both the Vaidyas. So yeah, I now hand over the session to Dr. Geeta Puttur, and please carry on.
Thank you, ma'am. Now I request Dr. Nivedita to introduce today's speakers. Dr. Nivedita.
Yeah, good afternoon, everybody. Dr. Rekha AB, BAMS MD, MD Ayurveda, and Dr. Archana C, BAMS CFN, MSc in Food and Nutrition. They have 16 plus years of experience in treating metabolic, hormonal, and lifestyle disorders with Ayurveda medicines, food and nutrition. Treated more than 10,000 pandemic disease through Ayurveda food and medicine. They have conducted more than 200 seminars and workshops about Ayurveda, diet and lifestyle at national and international levels. Trained many chefs for plant-based diet, season-based diet and vegan diets. Launched Ayushi, postnatal care services at Bangalore, and hundreds of moms benefited with this. Came out with more than 15 food products under FSSAI, which works as medicine. And who they are? They are two eminent daughters of India, dreamed about changing world by influencing with their herbal medicinal knowledge. Dr. Rekha and Dr. Archana at Mahanasa do not just treat patients, but also educate them but also educate them to create awareness about healthy diet and lifestyle. Since 2015 till now, number of people's life changed. They have changed by adopting Ayurveda food and nutrition and living their healthy life without mere any ailments. At Mahanasa, they aim at meeting people consulting for their wellness keep-up rather than treatment for diseases. They also treat patients and take them to a way where they come out of symptoms and live a healthy life. And about Ayurveda cooking for healthy living, they have a food and nutrition course. They conduct Ayurveda food and nutrition certification course. The attendees will gain the knowledge about Ayurveda, body nature, seasonal variations, common diseases, and qualitative analysis of day-to-day food articles as per season and as per their body nature. One can reduce hospital visits to up to 80% after learning and adopting this course details. Thank you.
Thank you, Dr. Nivedita. Now stage is yours. You can start, Dr. Rekha and Dr. Archana, ma'am. Okay,
Thank you
over
so
to
much,
you.
Edita, and thank you so much, Dr. Geeta. You all know that last webinar that we have done, case presentation and the cancer of hypopharynx. And today we are going to, addressing the most critical and often overlooked contribution to the cancer, that is diet and nutrition. Okay, so during our early practice, not even during, like it's kind of, when I was in the college, when I was studying the BAMS, even I was believed that many metabolic disorder like diabetes, BP or thyroid, everything is, just manageable. The patient need lifetime medications. The once it comes that we cannot cure, because while growing up also I had seen many of my relatives, family members, they were taking the insulin injections. It's kind of, they are telling that it's not curable. It was set in my mind. But once we started to practice, once we decided to practice, then we question ourselves. Then what are we going to treat? If we cannot cure any simple diseases, it's most common diseases, then what we are going to treat? That made us to deep dive into Ayurveda and explore real facts of Ayurveda, that how can we cure the disease. Okay, so when the patient comes to Ayurvedic doctor, they expect that, like not only the prescription or not only the medication, they expect that, most of the patient, they don't know what to eat and what to avoid. They expect us, we have to do that. That's where that Ayurvedic doctor, can become nutritionist, even dietitian also. Not only the doctor, only Ayurvedic doctor can become a nutritionist and dietitian also. I will just share my PPT here. Meet needs permission to screen share.
I need to give the permission, ma'am. Like,
Yeah, you have to give the permission.
I think nowhere it has mentioned here, like how to give the permission.
It's saying that
Previously, you have done, right? Screen was shared by Dr. Archana.
So,
I think I will just end the session and again log in. Okay.
yeah,
Just a
please.
second.
Yes, that is good.
Again, it's saying that, setting for the its update screening.
Dr. Rekha, 1 second. Dilip sir will speak. Sir, heli sir.
ಅದು ಆಕ್ಸಿಸ್ ಇದೆ ಅದು
Access.
ಶೇರ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಕ್ಸಿಸ್
Yes, sir. It is there like. Sir, 1 ನಿಮಿಷ ಜಾಯಿನ್ ಆಗ್ಬಿಡ್ತೀರಾ?
Sorry for the inconvenience. Please wait for 2 minutes.
Ma'am, till then, I think we can discuss something.
Archana, will you take over?
Yeah, he's just sending me. I will share the PPT.
Okay, fine. Then. I think Nivedita, let them come.
I received it. Yeah, I'll share it now.
Okay.
Can you see my screen?
Yes.
One minute, I'll just share.
Yes.
It is seen, right?
Yes.
Okay.
You can continue.
I'll just mute myself a minute.
Okay, that was I was telling about, only an Ayurvedic doctor can become a doctor, dietitian, and a nutritionist. That is the specialty of Ayurveda. Okay. This made us to realize that addition of being Ayurvedic doctor, that we can become, we have to treat the person as a holistically. So the most of the, when we are looking to the causes of the cancer, so there will be a 30% of the cancer comes from the diet and nutrition. So you can see that, in Krishnamma case, she is from the, in the last webinar that we presented the case that the Krishnamma, she is from the Anantapura district, Andhra Pradesh. She was suffering from the cancer hypopharynx with the esophageal candiditis and antral gastritis. Okay. So when we look into her history, so many of her family members are suffering from the cancer. Her mother was suffering from the cancer. Even her cousins in the elder two sister also suffer from the cancer. So she had a hereditary history and the diet history also. Her diet habit also, diet and lifestyle was also the worst. So when we are taking this condition, so many times, in the earlier our experiences that, so hereditary that we can cure or not. So many people, many of our junior doctor also ask, it's a hereditary, right? We should take this case or not. So when we are thinking about that, we just realized that many earlier, in many uh, past years, that we have treated many hereditary cases also. So for example, this is Ashwin. He's 32-year-old guy. He was diagnosed with the ankylosing spondylitis. His genetic factor for ankylosing spondylitis, that HLA-P227, was positive. He was suffered from the ankylosing spondylitis since past 8 years. You can see here his C-reactive protein is 354 and his ESR is 101. So he was taking every week one injection. With that injection only, he was able to go to the restroom, even toilet, he can use the bathroom. When he came to our clinic, his uncle was holding him and he was suffered to even step. Actually, for each step, he needed a help. So we had been treated him within 2 months. His all report came normal. His creatinine became normal, ESR became normal, and he was out of all the pain. He was completely normal. Since 8 years, he was suffered from the pain. He couldn't able to even step one step also, but he was out of pain within 2 months. And he was so surprised after seeing his result. He asked me, doctor, they told that it's a hereditary. It's in my genes. Then how it got healed? We taken the test again. Next slide. We taken the test and again the result came positive. HLA-B27 is positive. That means the genetic factor within him is positive. He was more prone to this ankylosing spondylitis. But in spite of hereditary, we could able to treat him and he got cured. Like this, many cases in our past also, we had been treated many hereditary history. So that's why that inspired us to take the Krishnamma case here. So we eliminated that genetic factor. Let it be. Even though her family members are suffering from the cancer, let it be. We will only concentrate it mainly on this diet. That 30% of the cases can be handled with the we can prevent with the diet and nutrition. And why can't we try this? So that's why that's motivated us to take the Krishnamma case. So when any patient comes to the Mahanasa, the first thing that we do that, we will take their history and we will try to understand what is the root cause. Here, I told you that genetic factor we kept it aside and we concentrated on dietic because there is no alcohol consumption, there is no other carcinogenic, influence in her life. So we eliminated that, only that diet part that we had taken. So if any patient come to us, we will try to understand the root cause of the disease. Then we will try to explain the patient that how it can be avoided, that root cause. Next slide. So here the root cause is mainly the food. Okay, for her, she was eating lot of junk food, like we could say that a lot of bakery items, even chutney pudis, pickles, non-veg, because she is from the Andhra, she was eating lot of spicy food, and almost weekly 3 or 4 days, she used to consume a non-vegetarian food. And only 3 people at home, and her husband was bedridden, and son was practicing allopathy. He has his own busy practice. So that's why he had a help, and they used to bring all these kind of junk food. Actually, they were kind of addicted to the ready to eat food. So we have to correct. First thing is kitchen ingredients. The second thing is kitchen. Okay. So when we consider the kitchen ingredient, the meat. So earlier days, the meats were, usually in front of the customer only, they were cleaning it and they were giving it to the customer. But nowadays what happened? They are keeping it in the storage, like, cold storage. And it's so much, it will be filled with the nitrates and nitrates. After heating it, for doing the high grilled or high temperature cooking, this nitrate and nitrates will convert into the nitrosamine. This will directly link to many cancers, actually, colorectal cancer kind thing. Even this lamb or beef or pork, like, red meat also, it will have a high content of HCA. This will directly link to colorectal, pancreatic, and prostate cancer. Along with that, this sugar content, like, sodas, mainly the sodas or pastries or candies, these things will have so many, even though it doesn't have any carcinogenic directly, but it influences our body to get into the obesity and insulin resistance. It will create an environment for the cancer growth. And many fried food, like in a fast food chains like KFC or Domino's, like that, it will have a French fries and the fried chicken and deep fried snack. This will have a acrylamide content. This will link with the ovarian, kidney, and endometrial cancers. And alcohol, that everyone knows that it will damages the DNA and impair nutrient absorption. So it will directly hit the liver and mouth, throat, and breast cancers. And in many food that we will have a artificial sweetener. Like most of the bakery items, whatever you take, that, biscuits or rusk or bread, even the pastries, even candies, or any kind of, ready to eat products. Nowadays it's very common. If you ask the people that what you cook today, they might tell it's a jamun for the festival that I have prepared the jamun, but they will bring the ready to pack from the outside, and it will have a artificial sweetener. Even the women Horlicks or some boost or these kind of, most of the stuff, even the badam milk also, it will have an artificial sweetener, and it will link to the leukemia, lymphoma, or brain cancers. Even though in the package it has written that, it's safe to use, but if you are consuming, on daily basis, definitely it will exceed the limit of consumption. Even when we consider trans fat, it will be available in the margarine or any kind of ranches, even processed snack. This will increases the inflammation, oxidative stress, and insulin resistance inside our body, and it will directly promote the carcinogenesis. Along with that, most of the people nowadays, they don't prepare any sambar pudi, chili pudi, or dhania powder, all those things. They will go for the ready to consume, like, chili powder, coriander powder. Nobody knows that how to prepare the sambar powder nowadays. These ready to use sambar powders will have a high sodium, even that pickles also. This will also causes the inflammation and cell damages. And some kind of, that even for the, when person is suffering from the fever, they will go out for the bread, right? Instead of khichdi or rice item, they will go for the bread. These white breads also will have many refined carbohydrate. Even the wheat flour, whatever the wheat flour or maida product that we are using, this will also spike the blood sugar, and it will become the insulin resistance in your body, and it will be directly linked to the colorectal, breast, and pancreatic cancers. Like that, whoever comes to our clinic, the first thing we will try to introduce them, we will try to give knowledge to the person that how they can prepare their food without using, without influencing with this carcinogenesis. See, it's sometimes we feel wonder nowadays that, whatever the food is available in the market, more than 2,500 carcinogenesis additives are using, and more than 12,500, substances are causing the carcinogenesis in the food. If you are eating outside, the most of the time. And even if we are preparing at home, with we are we were preparing the food from the scratch also, it will be very difficult to avoid all the toxins. Okay, so that's why we will try to convince the person that how they can use food ingredients safely, how they can opt the food ingredient safely. So once the ingredient part is done, once we correct their ingredient, once they make sure that they will understand how to pick the ingredients in their kitchen, the next part is we will try to correct their kitchen utensils. Okay. The most of the people nowadays for easy life, they will be using the non-stick cookwares. This non-stick cookwares will commonly contain the Teflon coating. This Teflon coating, once it start to heat, once it reaches the 260 degrees Celsius, it will release the toxic fumes. These toxic fumes are carcinogenic. It will affect our liver, kidney, and it will lead to the even testicular cancer also. That's why we always suggest that stop using these non-stick tawas or non-stick, even for the dosas also, stop using that. You can use some iron, that heavy, thick iron content that you can use. Even aluminum. Aluminum has, people knowingly, unknowingly, they will be using the aluminum cookware, especially that cooker, you know. So that cooker aluminum also, it will have a so much side effect and it will be linked to neurotoxicity and Alzheimer disease. So that's why we will tell them to eliminate aluminum substances in their kitchen. Then most of the people that they do mistake in storing the ingredients, kitchen ingredient, that is plastic containers. That most of the plastic container will have a BPA. So earlier days there was a Tupperware, product was so famous that everybody in it was in everybody's home actually. Tupperware is the safest one, it's a nicer one like that. But it was a BPA content. After that, so many years, the government has banned BPA plastic BPA plastic containers. This will hamper the estrogen production and it will disrupt the hormone level and it will lead to the breast and prostate cancer. That's why we will tell them glass storage or the very high quality steel content of the storage boxes will be best for them to use. So we will suggest them to eliminate the plastic containers for the storage. Then for the microwave, they will be using the glazed ceramic cookwares. So ceramic is okay, good, but when it is glazed, it will be used as a lead and cadmium. So this will lead to this is the carcinogenics. That's why we have to avoid glazed ceramic, even glazed clay pots also, it will have its own side effect. If you are using the clay pots for the curry and all, we usually suggest the clay pot, but it's a natural one, not the glazed one, not anything, mixed one. So pure clay container that we will suggest to use. Like I said earlier, stainless steel will be, high quality stainless steel doesn't have any side effect. So that's why we said that we can use, if it is a high grade stainless steel cookware that they can use. That most of the thing, we will convince the patient that it's very easy if they can able to use simple, clay pot, one steel cooker if they want, and some glass container to store the kitchen ingredient and simple ingredients, not processed. Like if they want a ginger garlic paste, they can prepare ginger garlic paste at home. At, like whenever it required. Don't bring the ginger garlic paste from the outside. Even the red pepper or coriander seed powder, all those things, no. So we will try them to explain. Just we will tell them, just take the that ready to eat whatever that batter, that dosa batter you will bring, or some Maggie packet that you will bring. You just see the ingredient in the backside. You will see many ingredients that you don't know. If you don't know those ingredients, don't eat it. If you cannot prepare those ingredients, don't eat it. If you can prepare those ingredients, then prepare at home and have it at home safely. So that's how we will try to convince the person how they can correct their ingredient, even that kitchen utensils. So once they understood the importance of this ingredient and the cookware, then it will be easy for them to guide. So how to prepare the food and what kind of diet they required for that disease, that thing that we will explain. So whoever comes to the clinic, this is the what that we do. We will try to find the root cause. Then once we find the root cause, if it is directly linked to the diet and nutrition, then we will try to correct their ingredients, that what they use for the cooking. And after that, they will try to correct their kitchen utensils. After that, we will try to make their personalized diet. So how do we prepare? How do we customize their personalized diet? That I think Dr. Archana will explain it now.
Yeah, I'll continue. 1 minute, I'll share it. You can see, right?
Yes, doctor.
So next, when we come to the, how do we select or how do we approach with the diet with any disease? But now I'm speaking with the cancer only. The first thing will be Ayurveda concepts. Ayurveda concepts, like we can use the Ayatana, that is Rashi, Desha, Kala, Prakriti, Karana, Samyoga. This method we can use. Like Prakriti is ingredients nature, that is Rasa Panchakas. Karana, preparation methods, that is cooking methods and processing. Samyoga, food combination to avoid incompatible and to use more of compatible foods. Rashi, that is quantity of the food intake. We can tell it in the means of Ayurveda or in the means of the RAAOUS. And Desha, that is the place of the individual and the food where they are taking, the place where they are staying. Season, Kala, Upayoga Samstha, there are so many rules to be followed in a diet. As we all know, we have studied like more than 50 rules are there. Like they have to sit and eat, they should eat slowly. There are so many rules, those things. And Upayokta, finally the individual, that is how the Prakriti of the person, all those that we will take into care. And then other concepts also, like the dosha concepts, Prakriti concept, Rasa Panchaka, it came in the this one Ashtayatana, and whichever the other concepts can be included to create a diet chart, we can include that also. And once we take the concept, then we have to diagnose the dosha, which is the dosha on the higher side. So once the dosha is diagnosed, then which the other two doshas to be managed or to be controlled? Because since kapha is on higher side, we cannot give all kapha reducing foods where vata gets increased. That also we have to balance. So we have to diagnose which to be balanced, which to be maintained, which to be protected. Then according to that, according to the dosha diagnosis, we have to select the ingredients. So once we select the ingredients, then we have to prepare, create the cuisine, different types of cuisines. One thing we would like to tell here is, do not hesitate to create any recipe. Like example, if you feel lemon rice to be added there, it is good, it is healthy. Don't feel, oh, lemon rice, it is so simple. What do they think? How do they think? Why am this doctor is telling lemon rice? Do not hesitate. If you feel that it has to be added, add it. Because once we had, like initially when we started the food and nutrition course, the first batch was from Italy. 2 students had come, and from India, that is local, Bangalore only, we had 3 students. So for the, before it was the live classes, now it is online classes. So during the live class, we had one recipe of palak puri. Palak puri, what we thought is, these localites, 3 people, they might feel, oh, they're teaching puri. But these Italians, they might feel very good because we are teaching this green color palak puri, we thought, and we started doing. Once we started doing that puri, when it pops up in the oil, those Italians, they were very much new. They knew about this because they had done the research, the Indian food, and then they had come. But the localite, 2 of them, wow, puri is coming up so nicely. they didn't know that puri will come like that. They used to just put it in the oil, just rotate, and they used to remove it. They didn't know that that puri can be so like a puffy. It can come and it will taste so good. They didn't know. I mean, what we thought was opposite. Like foreigners, they knew well, but Indians, localites, Bangaloreans, they didn't know. So that since then we started thinking, might be in future people doesn't know to put even seasoning, or they will not know even to do the lemon rice. So we have to document, and whatever we feel like we have to teach, we have to teach. Whether they know or they don't know, it is secondary. We should not hesitate in teaching. That is what we thought, and we started creating different types of cuisine. And one more, what happens once these cuisine or the recipes are ready, then we have to join them accordingly and prepare a diet chart. For example, easily digestible food should be added to the night, because night our digestion capacity will be low. We should not go with the heavy foods. And easily preparable food should be in the morning, because people doesn't have time in the morning, especially in the metropolitan cities. They will be busy with school timings for the kids or the office timings for the adults, or if they're adult, they have to leave kitchen for their daughter-in-law. There will be so many things going on. They cannot prepare, or they cannot take a long time in kitchen for preparing the breakfast. So simply and very less time taking recipes to be added in the morning. And heavy foods, if required, that should be in the afternoon. So, and also why? Because in the afternoon, one is it is pitta kala, it is easy to digest. Even though if it is heavy food, it is easy to digest until they don't sleep in the daytime. And one more, usually what happens when we have a light food in the afternoon, we feel hungry in the evening. Evening is a time where we end up in having unwanted foods. So if we have a good, if we give them a good lunch, then they don't feel hunger in the evening. They directly feel hunger by 6:37, where they can have their dinner, so that we can avoid that junk. And also we have to give in between, like juices or some hot drinks and things, so that they can replace with their most favorite coffee or tea. They can replace, and they don't feel that they have been withdrawn from that. And what we do usually in the diet, whenever we prepare a recipe, we just leave free with onion, garlic, ginger, pepper, all those for the taste. We don't interfere so much thing, because they should not feel we are giving a bland diet or it is very difficult to consume. They should not feel that. So we just leave it free. But we restrict not to use chilies or capsicum, or not more spicy or masala foods. That we restrict. Why we do so is, we remember once we had been to a house, I think somewhere near South Bangalore. We had been to that house. They were vegetarian, completely purely vegetarian, and they had given us dosa, that is pulses dosa, like they call this green gram dosa, pesarattu. Similarly, they had added with some more 2-3 pulses, and they had prepared the dosa with rice. Dosa was really good. We enjoyed it. We asked them the recipe also. They told like tur dal and other 2 dals with 3 gram and rice they have added with little coconut, and they have grinded and they made dosa. After eating, just after 1 to 1.5 hours, I started getting the complete burning sensation in my esophagus and stomach. And another person with me, she also started getting the gastric symptoms. So we were like, why this is happening? Why this is happening like this? Then we just went deep into the diet, like a recipe, what all they added. Then she started telling again. She told all those dals again, then coconut. Then she told pepper, ginger. Ginger was almost 1 finger length. It was little bit higher side, but we thought, okay, anyway, she's adding healthy spice. Pepper also she had added, and chili. We told, why chili? Already these 2 are there. No, chilies are required, or else the taste won't come. Okay. How many chilies you added? 2 or 3. She told 20. We were surprised. What? 20 chilies? She told, yeah, it is very big one, too big one. It won't give spice much. So I added 20 chilies, she told. That chili, she was right. It did not give spice to the tongue, but we could feel within 2 hours the burning sensation in the stomach, and of course in the next day morning with the anal region burning sensation also. They claim they're pure vegetarians. They don't eat spice. They don't eat masala. They are very good, having a good healthy diet, like all proteins and all those. But when we go deep into them, we will come to know that they are also doing the mistakes. And we cannot spare just because they are vegetarians. In fact, in our practice, we have seen more than non-vegetarians, vegetarians are using more spicy foods, which we need to go deep into them and then correct it. And that lady, she used to use everyday night Gelusil before sleeping because she also had burning sensation, but she didn't knew because of this. We explained her, don't know how much she used it. It was 8 years back, but 5 years back, she got operated with the gallbladder stones. Gallbladder stones is nothing but pitta ashmari. Because of high pitta, high bile juice content, she had that pitta ashmari, gallbladder stones, and she removed it also. I hope she could have followed what we had told so that she would not now got into that surgery. So preparing the diet chart and also teaching them the benefits. Why I told you this is just if we create recipes and just give them the diet chart, of course they will do some or the other mistakes. So we have to teach them the benefits. If we are telling something to take, we should tell why they have to take. If we are telling something not to take, that also we should explain. We should explain why it should not be taken. The big mistake in Asian culture, that is withdrawing the knowledge. That should not happen. If we tell, do not eat curd, we should tell why they should not eat curd, because they feel it is a good probiotic. It has a healthy gut bacteria. Why they should not eat? So we have to tell them in a different way. We can't tell it is abhishandi, it will obstruct the channels. They don't agree with us because we cannot show it to them. Of course, even the other way also we cannot show, but they agree with that. Like, you take the curd, it is good. It is a good probiotic. It has good bacteria, but don't take it in that form. You just churn, add more water so that the molecules get loosened, freed, so that it absorbs very quickly and it will have all the nutrients assimilation in the body. When we tell it in this way, this also we cannot show, but they accept it because we just go in their way and we explain. What we need, they should not use curd, they should use buttermilk. That's what we will tell it in a different way. Let them do Ayurveda principle, but approaching it in a different way. And then, of course, Ayurveda medicines, treatments, and follow-up also to be done. Next, in this case, like last session, what we had discussed the case, that is Krishnamma's case, CA of hypopharynx with esophageal candidiasis and antral gastritis. In her case, when we take particularly, when we diagnosed with the dosha, it was pitta on the higher side, and then kapha also, because cancerous cells are there. When the kapha increasing foods are more, the cancerous cells grow up very faster. So pitta and kapha we have to balance. At the same time, vata to be taken care so that it does not vitiate. Then rasa, when it comes to the rasa, mainly we can go with the pitta and kashaya, because these two rasas helps in reducing pitta and kapha both, but more pitta and kashaya can vitiate vata. So in between with the spices or the other foods, we have to regulate or control the vata. Then comes the guna of the food. I'm not going deep concept into the guna, but just to name you, we can go with the lagu, easily digestible, and snigdha and shita guna. And next comes the prabhava. Prabhava is a special effect of the food where now we need more of immunity and reducing the cancerous cells. So we have to select immunity increasing foods. And that's what Prabhava is, immunity increasing foods. And then according to their personal details, we have to create a diet chart and a lifestyle guide. When we take the history of the Krishnamma case, it was being discussed in the last session, this slide. She was from Andhra Pradesh and she was having more of spicy foods. Chutney pudi, pickle consumption was more, along with deep fried items. It was more. And also she had 3 kg of weight loss. So all these initially things, the pitta was more, we have to control. But when it comes to the weight loss, her muscle tone also has to be taken care. In modern concepts, when it comes to as a diet, usually what they tell, we have to increase energy, preserve immune function, increase muscle tone, and reduce the inflammation. That's true even in Ayurveda. We have to increase energy so that they can do their daily activities, and also immunity has to be increased, muscle tone to be improved, but we have to reduce the extra fat if they have it in the body, and inflammation also to be reduced. When it comes to the concepts of diet in cancer, modern versus Ayurveda, usually modern concept, they go with high protein. To increase the immunity or energy levels, they go with the less carbs and high protein. High proteins, especially they go with the plant-based proteins which offer high levels of vitamins and minerals, and also having lot of vegetables including in the plant-based protein like beans, legumes, nuts and seeds. If animal protein has to be chosen, they go with the lean animal protein like chicken or fish. But when it comes to the Ayurvedic concept of the same, we go with the easily digestible protein. We also recommend, but easily digestible protein like green gram or besan or brown chana, and we ask them to avoid animal protein and also nuts and seeds, because especially in Krishnama case, because it is high in pitta. They choose healthy fats, especially monounsaturated and polyunsaturated, which are high in omega-3 fatty acids like avocado, olive oil, grapeseed oil, walnuts, which also helps in reducing the inflammation and to improve cardiovascular health. These all things are true, but we go with the healthy like ghee. Ghee is the most required, especially the cow ghee, which is purely prepared, is the most required component to treat cancer. And also coconut oil, chia seeds can be used if it is really required, and also buttermilk, which is a good healthy fat. And when it comes to the grains, they go with the healthy carbs, which are minimally processed, which have high soluble fiber, and also has good gut bacteria, like whole wheat, bran, and oats. Because this soluble fiber, it helps in promoting the production of short chain fatty acids, usually metabolism. Soluble fibers. Whole grain, of course, we go with the rice, wheat, and jowar form, but not in the form of bran, or we don't go in that way, because it should not. I mean, we should have a clear gut. We feel bran and oats can obstruct the gut movement, so that's why we don't go with that. Then finally comes with the vitamins and minerals. It is very much required as per them, because it has a enzymatic process in the body. I mean, it takes a big role in boosting the immunity system and reducing the inflammation. So like milk, orange, yogurt, they tell, and also they tell fortified foods with vitamin D. Here we go with the prabhava of the foods like amla, draksha, haritaki, dadima. Such foods we select rather than going with the specific vitamin or minerals, because orange, yogurt, all those increases pitta. We cannot give. Even milk cannot be given directly. It increases kapha. In cancer, again, kapha increasing will increase the cells production very faster. So we have to avoid that. And also when it comes to diet, I mean, what they tell is diet can help in managing cancer treatment side effects. That's the concept. Not treating cancer. Because like side effects like appetite loss or constipation or diarrhea, loss of taste or nausea, all these can be taken care with the diet. Like appetite loss, like giving a nutrition snack, or constipation with plenty of fiber supplement. Then diarrhea, sodium and potassium supplement, and loss of taste with foods with spices and marinades and anti-nausea foods. We don't believe in that. We believe not to manage cancer treatment or manage cancer treatment side effects, but diet is to treat cancer, not for the management of the cancer, for treating the cancer. So we will go with whatever I had explained, the dosha. We had to diagnose dosha and then select the ingredients, prepare the recipes, arrange it in such a way that it becomes easy for them to prepare and also easy for digestion. And then we have to give it to them. And for that, here is a sample diet chart. In this, actually, I have added like 7 varieties of breakfast, lunch, and evening and dinner. But for that patient, we didn't give so many because they should not get confused. Just for your understanding, like we can prepare in such a way, I have just added here. We had just given her 3 types, which she has to repeat. And once she was bored, we gave another 3 types, which she has to repeat, which made her easy to do it, because breakfast and lunch and dinner was same we had given. Breakfast was different. So 3 varieties we had given. And also we did the follow-up, like 10 days she has to send us what she had, what time she had, or she has to click the pic when she is eating and she has to send us, so that some mistakes like adding chili or adding tomato, all those should not happen. So in such a way we just took care. And according to that, according to that, first thing in the morning drink, we went with the Fanta of Dhania seeds, coriander seed water, because that helps regulating the bile content. It balances the pH level in the body. So Dania Fanta was the first option which she had to take every day in the morning. In between, badam gond and tender coconut was also added so that her pitta or a heat in the body reduces a bit. Then breakfast, as I told you, we had given three, but I'm just explaining you the options. We can go with barley roti, not barley powder mixing with atta and preparing chapatis. Here it is barley roti, like akki roti or ragi roti, how we prepare. We have to soak barley, boil that barley, that water can be consumed, and then that barley should be smashed, add it with a little bit, like 1 or 2 spoons of rice flour, and then onions or coriander leaves, all those can be added, and roti has to be prepared. This is very good to control the bile juice or to reduce the pitta in the body. And of course, barley is the one cereal which reduces pitta and kapha both. Usually other cereals like wheat or rice and all increases kapha a bit, but barley is the only one which reduces kapha. So we had given her actually barley roti 3 times a week. Then amla rice. Amla, we all know it is a prabhava only, it is a immunity increasing. So amla rice is very simple, just like a lemon rice, but instead of lemon at the end, we have to add grated amla. So easy for preparing. So amla rice. Then methi dosa. Rice and methi should be soaked in the night. Morning they have to grind non-fermented dosa. Easily preparable. At the same time, methi also helps in balancing pitta and kapha. Then green gram khichdi, not the half broken, because it might increase vata. We have to control here vata also. So here green gram khichdi, which will not increase vata, same time it balances the doshas. And then coconut milk rice, like ghee rice. I did not mention ghee rice because I have seen many people ghee rice doing in a different way, like a tomato juice or a cabbage leaves juice, like all non-foodie ingredients they added for this recipe, which actually spoils the ghee rice name and also its effects. So I have just named as coconut milk rice, where we cook the rice with the coconut and ghee. That is very, very healthy because coconut increases peristaltic movement of the intestine and also it increases immunity. Once the intestine's gut is clear, it becomes very easy to reduce the cancerous cells. Then wheat dosa. Usually when the pitta is on higher side, we don't recommend chapati, roti or parotas. Wheat dosa, just they have to mix the wheat powder and put the dosas. That does not increase pitta in such a way which increases roti, paratha or chapatis. Then methi green gram pulao. Pulao, like biryani, pulao, there are so many types of what they prepare in the name of other things. Usually they do it with more oil or the coconut grinded ones. But here the simple preparation, like little onion and methi leaves to be fried with Indian spices, then add rice and water with dhania powder more and salt. That's all we tell. The taste is it will be very good, will be too good. At the same time, it is easy to prepare without any masala or spices. Breakfast, we ask them to take it within 8 to 8:30, and in between, except water, nothing else, they have to go directly for the lunch. Lunch should be within 1 o'clock. They have to complete the lunch. So gap is too little. That's why in between we don't add anything. So for the lunch, we can tell them green gram sambar or sabji, rich guard sambar or sabji. We can tell them like sambar or sabji in any way they can prepare. But in between, like kokam rasam, because sometimes when vegetables also become sometimes heavy for digestion. So in between, rasam will help to reduce the activity, like digestion activity, it reduces in the body. Brown channa sambar or sabji, basale sambar, ashgard, amaranth, all these are healthy. I mean, as per her case, so we can do it as required the lunch recipe. And then evening, barley roti, here is barley soup, because the barley whatever they have boiled, that should not go wasted. In the evening, a little bit of ghee they can add with salt and pepper, and they can have it as a barley soup. And also they can go with buttermilk with narikela lavana. It balances pH level very good. And Yashti Madhu tea, that is also good in balancing pH level. We know that Yashti Madhu Kshirapata, that is what we tell them as Yashti Madhu tea. Hibiscus tea, hibiscus flower, we get it in online also now, Amazon dry hibiscus flowers we can use. Shankapushpi, that also we get it online. Durva kashaya, durva powder we get it. We can prepare kashaya. Amla juice, but not the bottled or canned. It should be freshly prepared amla juice. Again, dinner, I told you we told her lunch and dinner same, but here I have given recipe names so that if you require, I mean, you will understand better, or if you want, you can use this also. Coconut milk stew. Yeah, it is a Kerala style stew with vegetables. The coconut milk is added. That stew, we can have it as a soup in the dinner, or with rice, or with dosa, or with wheat dosa. Anything also it can be had. Neem flower rasam. Preparing the rasam without tomatoes and then adding neem flower on the top. Point guard sabji, plain rasam, just the dal water rasam, or even plain water rasam also can be given. Ivy guard sabji, fenugreek sabji, chocho sabji, all this anything combination we can give, but we had given 3. But we had told her every 1 hour to have warm water 100 ml, minimum 100 ml. If she wants more, she can have it, because dehydration has to be removed to reduce pitta in the body. And also to avoid spicy foods, and also have all favorite foods like pickle, chutney powder, peanuts, because those were the things which caused her this. So she has to avoid fermented foods, bakery foods, curd, banana also increases vata and kapha very much. We have to avoid banana, but raw banana if required can be added in the recipe, but not the ripened banana. Tomato have become a very common food. Tomato, potato, onion. These 3. Onion is at least okay. Potato and tomato, they without these 2, sambar or rasam or anything will not be prepared. Such a addiction it has become. They have to avoid potato. They have to avoid tomato. Potato because it increases kapha and also vata, and tomato because its pH level is higher. And once we cook, as much we cook, that much pH level keeps on increasing. I remember tomatoes at my home, it was not used at all. Very rarely, might be 6 months once, if any, if any relative who likes certain North Indian food, my mother used to give me money and used to ask me to get tomatoes, because I remember this, because we used to, we had to walk 1 kilometer from our house to get some vegetables. So I remember very well. I used to go by walk and I used to get it. She used to never get tomatoes. But now, if we tell someone, don't use tomato, the first thing they tell is, how can we prepare food without tomato? Not only I'm telling, since we started this Mahanasa, even we stopped eating tomatoes at home. It's almost more than 9 years I didn't get tomatoes. I didn't purchase tomatoes to home. Of course, outside, we try to, wherever possible, we try them to, we will tell them not to add tomatoes. But when we go for a function or events or some other house or some restaurant, sometimes we cannot avoid 20% tomatoes might go inside. But at home, we don't get tomatoes at all, because we believe in not just telling, we should also first do and see how we feel, then only we should tell. Even the recipes, whatever we have given, everything will be prepared by us first. We will taste. If it is good only, we will add it in the recipe. We just don't just like that mix it and add it. That also we don't do it. Then maida, deep fried, rava, especially when the patient is a diabetic, it has become a, don't know how that concept started. If they eat rava, it is good for diabetic, or it is very healthy. Rava idli is healthy, rava upma is healthy, rava dosa is healthy. I don't know why this concept has started. You yourself, when you have cough or cold, just try having rava dosa, rava upma, rava idli. Within half an hour, your cough and cold and cough mucus increases. Within half an hour, it increases. When the kapha is increasing, how can it control any lifestyle disorders? Even diabetic cannot be controlled at all by using rava. If they have to control diabetes, they have to stop avoiding rava. Then only they can get into the control. Similarly, if kapha has to be avoided here in the cancer, so she has to avoid rava. Cruciferous vegetables, high in chemicals. Of course, others are also there, but these are very high. Like in the previous session, also I had told, like one example of the brain tumor. Then sugar, sweet should be avoided. Not only sugar, even jaggery also we had told to avoid for her. Refrigerated foods, each and everything is a refrigerated. They get not only the prepared foods, even powders, they get it from outside, they keep it in refrigerator. This legumes, they get it, they keep it in refrigerator. It has become, refrigerated has become like a storage box or a storeroom. It has become I have a, I don't know, good habit or a bad habit. Whenever I go to some house, if you are free in that house, first thing I do is I open the refrigerator and I see what all they have kept. I have a habit of that. I have seen so many people keeping so many unwanted things. Today we we had one webinar with VASC. Every Wednesday we will be having that webinar. In that one, we were speaking about the nasal disorders. So one lady, she just asked about, we are telling to put ghee, cow ghee for the nose, for the nasal bleeding. So she asked, can I use Nandini ghee? I told, if you get good organic cow ghee, or if you can prepare at home, go for that. Worst scenario, go for Nandini ghee. She told, I prepared the ghee, but it is smelling very badly. I asked, might be the storage is wrong. You might have kept it in plastic bottle. I think keep it in steel or glass. She told, no, I kept it in glass and I kept it safely in the refrigerator. Ghee is something which has to be kept outside so that the processing has to go on. We all know, like how much ever old the ghee is, so much it is good for the health. When she keep it in a refrigerator, how the processing will go? Definitely it will spoil. So I told her not to do that. Keep it outside. Ghee, honey, everything should not be refrigerated. Those are the things which has to be kept outside. So, people are becoming like, we have to educate them a lot. Until we educate them, people doesn't know which is correct, which is wrong. They just keep doing everything in a refrigerator. Each and everything. They cut apple, put it in refrigerator. They cut some bananas, again, but bananas also will go in refrigerator. It will be stinking. That banana smell will be stinking in few refrigerators. So keep what to keep or what not to keep in refrigerator also to be taught to them. And refined refrigerated foods, I told, black gram. Dosa, idli has become very, very common because it is easy to prepare, or we get a batter outside and we can easily use that. That has to be avoided. And again, the question is similar to tomato. If you don't eat idli dosa, what else to eat? We have just told how many, 15 or 20 in this avoid. Only that much we have told to avoid. There are so many other things they can eat. But people have become restricted to these 15, 20 foods only. They don't know the outside. These also the food exists. Outside this also they can prepare foods. They have forgotten that. That is also one of the reason for becoming cancer, 30% diet to be the reason for the cancer. And of course, the non-veg, everything they have to avoid, whether it is a red meat or a lean meat, they have to avoid the non-veg. We had told her to completely avoid. And also heavy foods, millets because it increases pitta, quinoa, oats, and preservative added foods, and also incompatible foods. Incompatible foods teaching is very difficult. Only one or two only we can tell them. That's why for 10 days we will ask them to report us. Whatever they are eating or drinking, they should report us along with the time so that we can correct it. We can correct it then and there. With all this, then lifestyle. Avoiding day sleep so that kapha should not increase, and waking up before 6:30, again not to increase kapha, and also avoiding day sleep to increase the metabolism or the digestion capacity. Sleeping before 9:30 for not to increase pitta. So these three to be taken care. Along with that, yoga or simple exercises. Heavy may not be required. They might feel lethargic, but yoga or simple exercises is required. And breathing exercise or meditation, like yoga or simple exercise to keep them physically fit. Where it comes to meditation or breathing exercises, it to keep them mentally or emotionally fit. Because we might easily speak as a professional about the cancer, but for the person who has cancer, it is a different mindset. So for them to keep that mind stable, they have to go with meditation. And then finally, Abhyanga and sunbath, that is oil application and sunbath, if they have an option, morning or evening, to avoid osteoporosis, because osteoporosis is also one of the major concern in cancer. To avoid that, this has to be taken care. And also we can avoid fortified vitamin D foods when we do this. So when we apply the Ayurveda concepts and prepare a diet with a qualitative and quantitative approach. Qualitative is an Ayurveda concepts and quantitative is a modern concepts when you mix up and prepare a diet chart, but express them in a modern nutrition way. Then they can easily follow and we can easily get results in this Ayurvedic diet for any type, not only cancer, for any of the diseases, we can easily get this result. For that, we also do Ayurveda nutrition course. Usually, whoever the patients, once they get treated, we recommend for the Ayurveda nutrition course. And of course, they will join because they know the value of the food once they go with all this. Once they do this diet and all those, not only the particular like not only like cancer, but also whatever she had, like in between she had migraine or nauseatic or lethargic, all those was cleared. So even minor conditions was taken care. So even she felt very good. Not only she, any other patients, they feel very good. And once we recommend, they easily join for the Ayurveda nutrition course also. And in that, why we ask them to join is because they should not do the same mistake and they should not get back that again that disease. So they should be aware of what to do, what not to do completely. We cannot guide them every day. So they should be their own doctors. So in this course, we teach Prakriti analysis, Dinacharya and Rutucharya, seasonal cooking, ingredient benefits, mindful eating and living, healthy recipes, healing home remedies, all this. It's an online course for 3 months with a certification course. We teach all this. And also, we got a book also. It is in Kannada version about the seasonal recipes. Actually, I don't think any other books are there on the seasonal recipes according to the Sharad Rutu, Varsha Rutu, because we thought people should know according to Rutu what they have to eat. In summer also, they will be having this spicy and masala foods. And in the winter, they will be doing the diet with little food. Those things should not happen, which leads to heart attacks or any type of skin or skin issues or malnutrition or overnutrition. All this should not happen. So for that sake also, we had bought this book also. So finally, and totally, we believe in Vaidya Lolimbaraja's thing, Patye Sati Gadartasya Kim Aushada Nishevane. That is, when we follow our diet, actually the medicine is not required. Patye Asati Gadartasya Kim Aushadam Nishevane. When we don't follow the diet, again, any medicine is of no use or it is not required. So we believe in this, and similarly, we adopted also the same. And apart from this last or the least, we can tell, not included with cancer or anything, but one thing we would like to share is, I mean, because all are doctors here, so I thought this is a good platform. We can always see that Ayurveda doctors' unity is very less, not like allopathic doctors. So that we should not let it to happen. We should be unity. That can happen only when we do not blame any prescription or any treatment of the other doctor. Usually what happens, this we have so many times we have experienced, when we refer to some other doctor, they just say, no, this is not the treatment, why they have given this treatment, this should not be done, and they will change the treatment. Few patients will change, but few patients, they will call back, no, they are telling like this, you are telling thyroid is curable, but they are telling thyroid is not curable, you go for allopathic, they are telling. It has happened with thyroid, BP, even cancer also, this has happened. So that should not be done. As myself and Dr. Rekha, whenever we get a referral patient, we don't interfere with the treatment. We speak to the doctor, we will call the doctor first, we will ask them what to be done. Similarly, we will do, and we will send the patient back. Even if they ask also, we will tell, you please consult your doctor. If your doctor tells to consult us, we are ready to consult, but your doctor has a good treatment. So we will send them back. If we feel it is not good, or might be the treatment what they have given is not good, let us speak to the doctors directly instead of telling it in front of the patient. Because whatever we tell for the patient doesn't take my name or your name or other name. Like they don't take, oh, Dr. Archana told, Dr. Geeta told, Dr. Rekha told. No, they don't do that. They tell, I went to Vijayanagar Ayurveda doctor, they told to do this. Sanjay Nagar Ayurveda doctor told not to do this. They tell Ayurveda doctor. Not in case of allopathy, because they are specifically specialists in organs. Though they speak in names, Dr. Manjuna, Dr. Raghavendra, Dr. Naveen. You know Dr. Naveen, they speak like that. But when it comes to us, they tell Ayurveda doctor. So if we blame or if we criticize any treatment or the protocol or the prescription, anything, we are indirectly spoiling the name of Ayurveda. We are not becoming great. We are not becoming great by taking one patient or two patients. Let's not do that. Let's respect each and everyone's prescription and treatment. Even though we see a junior doctor has prescribed something wrong, let us call them directly. The patient will give the number, how much time it will take to call them, and we can ask them why they have done this. So if we feel it is good, we can continue. If we feel it is not good, we can ask them how it will help. I think last time also I told one patient for the ear infection, ear discharge. She was from Hubbali. We had referred for Karnapurana and Nasya. one doctor rejected that during the discharge we don't do, it will increase, your ear discharge will increase. I told, connect me to the doctor, I'll speak to the doctor. They were not ready to talk to me. They told, no, we are not doing, and they sent her back. She was very much upset. I told, see, you can't come to Bangalore. Only option is you inquire with another doctor. Another doctor also, they told, when the discharge is there, we will not do it. But she connected. The doctor spoke to me. I told, see, nothing will happen. We have taken so many cases. It will reduce. Don't worry. You please do it. She told, I'm not responsible because you are telling I'm doing it. I'm not responsible for anything, but I'll do the treatment. I told, okay, go ahead. I'm the responsible. Whatever happens to her, don't worry. Then after the treatment, I had told for 10 days. Within 8 days, the ear discharge, everything was stopped, and the pain, everything was around 80%. It was reduced. The doctor was like, of course, she's the junior doctor. But let us not discourage them. See, this case made her to treat next so many patients. Like whoever comes with the discharge, she will definitely not send to ENT specialist. She will only treat by herself. So she got an experience. Even she told me, oh, doctor, sorry, I thought it will increase, but it has reduced much. Our treatments are like that. Our Ayurveda specialty is like that. Might be the approach is different. We have so many. For one disease, we have more than 100 treatments or medications. So everything works in a different way. So let us respect each other. So let us not blame or criticize anything in front of the patient. If we really want to criticize, let us call and directly criticize. Nothing wrong. If somebody calls and tell me your treatment is bad, okay, let me get explained. If it is really wrong, I will change it. Not in front of patients so that Ayurveda name gets spoiled. So this was one at the last I just wanted to convey. So next, we are free for next another half an hour or 45 minutes. We can have a discussion also.
Thank you. Thank you, Dr. Archana. It was a wonderful presentation. Actually, we should only start all these changes from our end. Okay. And I do agree this referral cases and all, whatever you said, that is true. We have to accept the truth, and we have to support each other. Thank you once again. And we'll take the questionnaires now. Okay. It's in chat box. I'll read it for you.
Okay.
Just a minute. Ma'am, can you share that diet chart for Ati Krishna person?
Which person?
Ati Krishna.
Ati Krishna.
Lean.
Krisha.
Krisha.
Ati Krisha person. Okay.
Krisha. Sorry.
See, we taught you the approach, how to do the approach. Like, see, diet chart, I have given many also, I can just send it. But let's not depend on diet chart. Just learn about the approach, like dosha, when the Ati Krisha is there. So let us take Vata on the higher side. So, or we can take similarly, in this person only the weight is less. We don't add something to add up weight or anything. The things what we do in the diet chart, what we have given, if they do, they will come for a healthy weight. If they are higher side, they will come to normal. If they are lower side also, they will come to normal. Just we can add more of this chironji seeds and then ghee. All those we can just add up a bit, but we cannot add more because our main concentration is on the cancer. The cancer cells has to be destroyed. So many a times what it happens, they lose weight also because sometimes it happens. That time we just see them that cancer is healed. Once that is healed, then we will go for gaining the weight. Again, weight gaining is not easier, but at least they should come for a healthy weight. Then we do that also. So go with the approach, like how we told, diagnose the dosha, select the ingredients, go with the approach. It becomes easy for you for any disease to create the diet chart.
Dr. Bhumika is asking, Rava is formed by wheat. Wheat is RP decreasing. What is RP? I don't know here. I don't think so. It is eye disease. But
RP.
I don't think so. It is retinitis pigmentosa. But what she is asking, I don't know. Bhumika, if you are there, you can raise your hand. You can unmute yourself and you can ask the question directly.
Is mentioning relative productivity or radiation productivity. Don't know what the RP is. But when it comes to Rava, anything wheat, once it is processed, any, like it can be broken wheat or wheat flour or anything, it is not completely healthy. I remember my grandmother telling she used to eat godi anna, wheat rice. Mean the whole wheat godi was soaked and prepared just like barley or rice, and they used to eat that because they had sugar, not the processed chapati or roti or rava or anything. So whole, even when it comes to, I told you, whole grains is always healthier. So whole grain is only better, but people are used to this chapati and also that wheat powder. We give them an option of wheat dosa. That's it. But usually whole wheat is only always beneficial, not rava or anything. And whatever they claim, it is high in RP or whatever the names they give, you just see from the scratch, from the nutrition and dietitian, whenever it started, the way they were before and now, they keep on changing. This is good, that is good. Approach, I mean, the concept, let us go with Ayurveda concept only. But when we are telling, let them tell it in a different way. It is a reactive protein, RP, probably they have told. Of course, I mean, protein in a whole form is always easier.
Okay. Dr. Ashok is asking, please share diet chart again, same for obese and diabetic also.
The same thing in Ayurveda, that what we believe is it's no universal diet that we don't have. It's a personalized diet. We have to consider the prakriti, dosha, everything. So based on that only, even for example, the Mandya person will be eating, ragi mudda every day, and the Mangalore person will be eating, red boiled rice every day. So we cannot make a chart, like a universal chart for everyone. So like Dr. Archana told that, it's a personalized based on the prakriti and the dosha and their food habit, and what dosha is increased based on that we can curate the diet chart.
BP decreasing, but in a chronic MEHA patient can be given, right, ma'am?
What?
B-
Sorry? What?
BP decreasing means wheat, regarding wheat only she is telling. Vata Pitta decreasing, maybe.
Okay. But in chronic patient can be given right.
Given right.
Actually, we had one more case of cancer with a tumor in the epigastrial region. He was diabetic. Actually, even today morning, his wife came to me. We were just talking about the same. He was so scared. Like, we gave only rice because it was completely pitta related. We cannot go with the wheat. Wheat will increase again pitta. It was very severe. So completely we gave the rice. But only thing rule we told is remove the starch and eat the rice. He was so scared. 2 months. I told, sugar, you leave it. If it is increased, I will take care later. First, you take care of the cancer. But after 2 months, it was so much low, like normal. It has become completely normal that even now he eats rice very, even she was telling the same. He was fond of rice. Now he eats so easily the rice. Now I left the pressure cooker. I only remove the starch and eat. So it is nothing that we have to go with the roti only. And as we have experienced personally, wheat increases pitta. It does not decrease pitta. That chapatis or rotis in the form when we have seen it increases pitta. Only in the form of godi dosa, it might little bit, reduce that increasing part. Not that it reduces pitta, but it reduces. That's why whatever it is, I told you, there is a story also that Shankaracharya, not Shankaracharya, sorry, I forgot the name. That person, one person, he got his child to him, and he told that, ask my son, he eats too much of sweets. You ask him to reduce the sweet.
Gandhiji. It's Gandhiji's story.
So first thing, he told just to come after 15 days. And in that 15 days, after when he came, he just told, son, don't eat sweets. He told, okay. So that father was asking, why did you take 15 days to tell him this one word? I traveled from so long distance. He told, I should follow first, then only I can tell him. Without following, I cannot tell him. Similarly, whichever recipe myself and Dr. Rekha will prepare first, we both have, after preparing so many things, we have become so much slight variations or slight incompatible. Immediately we will come to know in our body reactions. We will immediately tell this is not good, this is not good. So much we have become what we can do by trying all this. So we always try. So our personal experience, wheat will not decrease pitta, it increases pitta.
Okay. Is chia seeds Ushna or Shita?
Geeta, just a minute. To add on to Dr. Archana, Dr. Notes, actually, I also agreed with Dr. Archana because I personally experienced, because when my kids were young, to make it fast, I usually prepare chapati rather than, because our basic food is North Karnataka roti. But that has increased and made so much of this thing. Not only pitta, it increases kapha also. That's what I experienced. But when I have started consuming roti, that pitta shamana happened. Kapha is there still, but that is balancing with garam rotis. Like with little quantity of roti is more than sufficient. I think definitely it increases secretion in our body, which again increases this our meha part in our body. That is nothing but pittaja prameya and vata kafaja prameya, which leads to vataja prameya. So that the nowadays everyone is taking this rava or this godi part, wheat part away from the diet chart. Even they also knew about it, I think. My personal experience, what I felt. So that's what I wanted to share. Please continue. Yeah.
Is chia seeds Ushna or Shita?
Kama Kasturi Bija is Shita. Go with the local Kama Kasturi Bija. If they are in a foreign or somewhere else, let's replace to chia seeds. Not that, I mean, when in Bangalore or locally, let's not go for chia seeds. Let's go for the locally grown Kama Kasturi Bija, which is Shita. Chia seeds, okay, it is with Shita only we can tell it. It is not Ushna.
Is barley available now? Is original barley?
Actually, barley also we have a story. Like barley was used like a rice or wheat only in India, but due to this manufacturing of beer and beer consumption has increased and everything is getting imported to beer factories, this barley, and we get it in packets of 20 rupees, small packets of barley. Barley is virginal only. We can, again, there are two types, polished and unpolished barley. Barley is good. We can go for it.
How to store unsalted butter?
Actually, in Ayurveda says that, butter, that fresh butter only we have to consume. So we cannot store for more days, right? Butter. So we have to turn into the ghee and we have to use it. So there is no reference of storing the butter. Only fresh butter that we have to use.
Kindly share your expertise in snacks option for children and teenagers.
We have this YouTube channel.
We have a YouTube channel, Mahanasa Ayurveda, and there we have, I think, more than 250 recipes actually. Even in Ayush TV, every day that, at 12:30 that our TV show is coming. There we will explain everything along with the disease, recipe and recipe ingredient benefits that we are explaining. And you can watch those episodes and you have plenty of options in that.
Okay, thank you. What is your opinion on having milk, coffee, or tea after breakfast in the morning, ma'am? There is no much preparations where we don't add salt.
See, coffee and tea, that always we say that no for coffee and tea because it's additive, caffeine content, right? So it's kind of additive. That's why we say that no for it. Even after having breakfast also, even for the empty stomach also. And I didn't get it. So there is no much preparation.
Because milk and salt is incompatible. So we cannot have milk after breakfast. We should have at least 2 hours gap to, or drink milk first, have 1 hour gap, and then eat the breakfast.
But we see like so many patients, like it is a normal routine, no ma'am. Soon after the breakfast, they go with either tea, coffee, or milk. So I always had a doubt. I used to tell them not to have, but I just wanted your expert opinion. Like it is a viruddha, right?
Yeah, it is viruddha.
Viruddha, they shouldn't consume. But once you strictly say that, they definitely follow. Once they find that, your treatment is working and it's curable, definitely they will follow your suggestion. Because we had seen so many people, they are addicted for 25 years, 30 years, even since the childhood, they left the coffee and tea.
And
Okay.
especially
So
when the
ma'am,
children are the kids are there, they give the breakfast, they don't eat little bit and they give a glass of milk and send. That is also, I mean, we have to teach them, educate them. They will
yes.
listen. And nowadays
So ma'am,
parents are also educated. They will listen very well.
according to you, ma'am, when is the best time like we can give the dairy, like milk products, like for kids also? When is the best time you feel that it doesn't act with the other food? This thing. When is the best time to give the milk, ma'am?
Morning or midday or evening. Again, depends on which person.
That's it. Yeah.
So it is better to give it like separately only, not with combination of any other food, is what you're
No.
suggesting.
Yeah.
Yes. Okay,
Milk,
ma'am. Thank you so
better
much.
is minimum 2 hours gap before and after for taking a
Yes.
milk.
Yes. Okay, ma'am. Thank you.
Can we use tamarind instead of tomato? If not, what else we can use?
Now, tamarind that we can use, I think I grown up in very rural place of Karnataka. There I had seen the tamarind. They used to take it and make a small ball, and they used to dry it up in the sun actually, and they used to store it for a long time. After 1 year only, they used to use the tamarind. That was the proper tamarind usage. But yeah, the tamarind that we can use instead of tomato, and if not tamarind, uh, kokum is there. That kokum can use, and it tastes so good actually, and it's very flavorful also, even colorful also.
Thank you. Nowadays, there is a trend of adding curds for preparation of kadai, etc. Also, curds for marination, especially in non-veg preparation. What is your opinion?
Non-veg, veg, everywhere the curd is added. It is incompatible food. Viruddha ahara. If you want to tell, ask them to go with the coconut milk. Replace with coconut milk.
Okay. Our air fryers are safe. Please tell about preparing puris, as I had a patient could not listen.
Tell about preparing puris in air fryer.
Yeah.
Air fryer, microwave. We don't believe in that. Might be how much ever technology it is, there will be some radiations to it. Without radiations, it cannot come. And we don't tell our patients not to eat puris. We tell them eat puris 15 days once. Puri is required. Then only we will be healthy. Healthy.
Okay.
I have read one research article. It was clearly saying the Indian way of frying, deep fry, it's very healthy. Like puri or pakoda or bhaji, that whatever you fry, right? We don't completely immerse in the oil, hot oil. It's a half of the part of the recipe will be floating in the oil, right? That is a healthier way. But nowadays, whatever in the fast food, that French fries or whatever they fry, right? They completely immerse inside the oil. That is where that's the problem is happening. And deep fried is not healthy because of oil. If you are picking the good oil like a coconut oil or something, and you shouldn't use it repeatedly. That's it. Once it is used, once it is fried, then that's it. You have to discard it. So that is the healthier way. Patient can prepare the puri, bhaji, pakoda, and they can have a fatty acid that in the like moderate level. That's fine.
Okay.
Hello, ma'am.
Yes. Yes, Dr. Par.
Ma'am, if I contact Dr. Archana and Dr. Rekha, what is their?
Sorry.
Let me know.
Can you repeat the
If I need
question?
to contact Dr. Archana or Dr. Rekha,
I think madam will add our contact numbers.
am I audible now?
We'll post it in the group. Contact number will be posted in the group. Okay. Contact details will provide.
Which group?
Ross group.
Which group?
Ross. Present group.
But I'm not in that group.
We can add your number. You can contact me. Okay.
But I'm okay.
Can you mute
So,
yourself?
how do I contact you?
Can
You just search Mahanasa Ayurveda, you will get it. We have a website, Facebook, everything. Mahanasa Ayurveda.
Dr. Bharat, if you want to add your number in
Good
the
evening.
group, please go through the poster. In that, 2 numbers are there. You can contact any one of that. We'll add it to you. Okay.
Good evening, ma'am. Good evening. Am I
Yes.
audible?
Good.
Yeah.
Good.
It's a great,
Yes.
wonderful lecture that I have heard today because I am not from medical field. I am from legal field. My sister asked me to join this. She's a Dr. Halamma. Actually, today I got a time to enter into your meeting, wherein I heard so many things like nowadays we are using tomato as if it is our traditional food. I mean vegetable. Now today only I got to know it is not so. Like instead of that we can use tamarind also. For thank you for that wonderful session. I have 4 questions to pose before you people. First one is about Siridhanya. Nowadays everybody is telling like go for Siridhanya and all. Is it good to use Siridhanya without looking into our region where we are from? Second question is about pickles. Our grandmother, even mothers used to prepare that pickles in home itself. Whether it is good to prepare in our home, otherwise to bring from outside. Whether it is good to use pickle. Third question is substantiating. I mean, instead of going for coffee or tea, whether we can go for curd milk, preparing in our home only. I mean,
What?
buttermilk that is. Fourth question, we are reluctant in using um, uh, what is that? Cooker and mixie. Whether instead of that, how to use some other utensils? Is it viable to leave cookers? Because as a working woman, it is very difficult. Like while cooking in cookers and all, we can do some other houseworks. So we will be thinking like we can save our time. What is your opinion on it? How to substantiate those things from using our normal vessels? Can you guide us, enlighten us about this? Thank you, both of you, and thank you so much.
Okay, her first question is Siridhanya. See, all Siridhanya, so whatever the basic ingredient that we use, everything is good only. But like we said earlier, it depends upon the your prakriti or personality. So that's why, like, like if you are consuming since the childhood that Siridhanya as your daily routine, then fine. But if you are Vata predominant person and if you are consuming suddenly you started 6 months back or 1 year back, then it might aggravate Vata in your body. That's why that when you are using, you have to think, is it suitable for your body nature or not? Then you can use it. No worries actually. The second question is buttermilk. I think she was telling, yeah, you can ask, you can drink the buttermilk as much as possible. That is good actually. Buttermilk doesn't have any contraindication in all diseases also, all seasons also you can use it, but only thin buttermilk. Don't have a lassi when you're sick or when your digestion power is low. The thin buttermilk that you can have it. And I forgot 2 other questions.
One more was cooker, pressure cooker. See, if you really want to use pressure cooker, go for a completely steel pressure cooker. But one more, without using the cooker also, you can soak rice or soak any dals overnight. Then you use it. It will almost take same time. And also, you can leave it on the stove and you can do other works. It will take around 15 to 20 minutes, where the same time with the pressure cooker, it has to rise and then it has to cool down. It is also same time. So if you want to really use pressure cooker, go for steel. If you really don't want to, soak it overnight. Plan what you have to cook, soak it overnight, and morning you can use. And of course, one more even I forgot.
Pickles, ma'am, pickles. Pickles.
Pickles.
Pickles are not good homemade or outside made. It is not good, especially for Pitta Prakriti person. For Kapha Prakriti person, it is good if it is a homemade food. But sometimes when the some regions we have for digestion, sometimes we require something amla rasa. That is what missing in our everyday diet. Usually we go with Madura, Tikta, everything will be there. But amla rasa is the one which is missing, which was substituted with the pickle. But nowadays, the process of pickling or the chili powder, what we add extent is not healthier. So better to avoid and go for some, what we call this, tambulis. So that is a healthier form of adding amla rasa.
Even for the pickle, so many, adulterant they will use it, and so many preservatives that they will use nowadays, and it will cause us, especially that it will imbalance the hormones also. So that's why, shop bought, store. If you are buying a pickle from the store, then definitely there is no. But if you are traditionally preparing, obviously in tradition that we use only little pickle once in a while, not for the daily basis for all the meal. Definitely no.
Yes. Thank you. Your practice of Matra Basti in cancer patients and their results.
Matra Basti, it depends on the person, but this person we can go for the Matra Basti. It was without that also. Again, it completely depends on the patient's history and how it is. Then we go with Matra Basti. Any Panchakarma will definitely have the good result in cancer, but it should be on the depending on that person.
Thank you. Doctor, they say black chana will increase the Vayu. It is also seen that in cases of increased Vayu conditions of they eat black chana, the pain increase or the condition increases.
Of course, yes, black channa increases vata, but to regulate the bile juice secretion, we need certain amount of protein. So not the Kabul channa or rajma will still increase. So we just add black channa once in a week or 15 days once. We ask them to eat, especially in the afternoon. So that will be balanced with the other foods what we give it in the diet chart. And if the pain is too much, we can avoid that. We can just leave it and we can go with the green gram only.
Okay, thank you. In amla rice, what to add to overcome its kashaya rasa of amla?
If once you prepare amla rice, definitely you don't feel any kashaya rasa, amla rasa. It will be taste more like it is so tasteful than chitrana also, lemon rice also. You just prepare once and you will find out there will be no kashaya rasa.
Actually, we left preparing lemon rice. We always prepare amla rice. We are just
amla rice. You don't have a taste of lemon rice.
It will be similar to mango rice, no ma'am? Like the amla rice, the taste, tangy thing.
Not very much, but it's a different taste. It is very good taste actually. You don't feel that kashaya rasa at all.
Thank you. Lot of influencers promoting seed cycling. That is usage of pumpkin, etc. seeds in different uterine cycles to treat PCOS. What is your opinion on its usage, dose, etc.?
See, any seeds, like even if it's a pumpkin or even simple kind, peanut or sesame, any seeds that we usually recommend, prepare some recipe, like a traditional recipes, laddu, some chickis, like that you prepare and have it. And it should be in the minimum quantity, like once in a while. How do we eat the snack like that? If you are consuming on everyday basis, definitely it will affect, some vata pitta kapha dosha, definitely.
Thank you. Your opinion on different types of cooking oils and its quantity?
Quantity.
Quantity depends on our cooking, but we prefer ghee first option, then coconut oil also. Ghee and coconut oil, especially for pitta prakriti. When it comes to kapha, we can go for sesame oil or sunflower oil, which is cold pressed. That is ganadenne, what we call. That also we can go for it. But don't go for this, what we call that packet oil, this sunpure or sunflower, what we call those oils to be avoided.
Okay. Your opinion on avalaki or poha for the breakfast?
It is good, but heavy digestion. So depending on digestion capacity, we can suggest it.
How about ragi?
Ragi is also healthier option that they can have it, but usually in the night time we say that don't have a ragi mudde because it's quite a heavy for digestion. So everyone knows that in the night time we should have a light food. That's why in the afternoon or in the morning breakfast that they can have a ragi. No worries.
Your course details will be shared in the group. Okay. We'll share it. Okay. There are some retail shops selling detox drinks and detox teas, etc. In your opinion, should it be generalized? For example, the juices and teas sold near Kabban Park.
Recently, Dr. Ahalya, madam, she had spoken. I don't know how many had seen. It was in the Facebook video. Now she is a VC, right, for Karnataka Samskrita, this one, university. She was telling, like, an engineering should do an engineering based work. He knows how to construct or how to build. He cannot tell for a doctor how it has to be done. Similarly, Shunti Kashaya cannot be had by everybody. That only doctor knows, especially Ayurveda doctor knows. So they're not the doctors. I mean, let's not promote that also. Even though if it is good, let's not promote that because they don't know the basic. We tell barley is good for everybody. They give barley. What the person who has high vata, it immediately increases. So they cannot decide. I think that is a very good video. If you get it in a Facebook, even if I get it, I can share the link. You have to listen to that. She has spoken with.
Thank you. Excellent session. Are you available for online consultations?
Yes. I think numbers later you can share it in the group.
Sure. What's your opinion on sprouted lentils and gram flour? Also, your opinion on multi-grain atta concept.
That sprouted lentil, we say that no, because it's heavy for the digestion. It will have a high protein content. Only those, the sports person, that those who can physically practice physical exercise, that they can do for 5 to 8 hours in a day, that I think they will be able to digest it. But a common person who will be sitting in the AC room or sitting in the chair and doing the desktop, they cannot digest it. So whatever the protein that we are eating on daily basis as a dal or in dosa or idli, whatever the protein that we are having, that much is, I think, enough for us. The gram flour kadle. Yeah, that we can use it. It's good only. So we can use it, no problem. And
but
the
but not multi-grain, because each grain has its own benefit. Let's not mix and make it heavy for intestine. Make separately. Make besan flour dosa one day and then wheat flour dosa one day. Let it be a different type.
We have to add food to our stomach. Very simple. Don't make it mixed vegetable curry, multi-grain, multi things. That don't do that. The simple food like a khichdi, rice, rasam, palya, simple chapati or palya, like that. Simple. Food has to recognize. Intestine has to, stomach has to recognize the food that what we are eating.
Yes, right. In millets, which is more effective or weight reduction? Effective for weight reduction.
Very effective in weight reduction, also very effective in inducing gastritis, hemorrhoids also. So it depends on, again, which season, which Prakriti person we need to suggest.
Yes. Please tell YouTube channel name once again. Mahanasa, I think.
Mahanasa Ayurveda.
Can smoothies be taken? Smoothies.
What smoothie? You can prepare a smoothie with coconut milk, healthy, or if you're taking smoothies which are available outside right now, it is not healthy.
Okay. Jowar roti is lagu or guru?
It is lagu, but it induces heat. It is good for that region. When we are in another, we have changed the place, like especially in Bangalore, pitta generally increases in Bangalore. The reason might be the pollution or the water or the way of living, it increases. So it is not suitable in Bangalore. Rarely is okay, not all the time.
Puja course details will be shared in the group. Okay. Can we use oats?
That oats and millets, that again it's vata induced. So that's why that we say that whoever required that vata increasing food in order to reduce the kapha, they can use it. But anything excess, amrutanu visha agatta anta heltivala. So anything excess, definitely there is a side effect. That's why every day in the morning eating oats means that we recommend. No, we don't recommend that.
How frequently can we use soaked dry fruits in little quantity?
Weekly once is sufficient. Or actually, our traditional is putting it in kheer or some food, not eating separately thing. So if you really want to eat, weekly once is fine, not more than that.
See, most of the dry fruits, like a badam or cashew, everything, it increases the pitta. So that's why, if you look into our traditional recipe, we use with, kheer or, kesari bath or some laddu, all those things, with the ghee and coconut, everything mixed, shouldn't increase the pitta. Like that, we will try to reduce the pitta content, and that's how that we use it. So if you're just soaking and consuming it, definitely that pitta will increase. And we had seen so many people that those who eat everyday badam and those who eat everyday, a peanut, they will have many skin diseases also. They will come with the skin diseases also. Pitta increased symptoms. So that's why, like, if you want to consume anything like a dry fruit or any nuts, go with the recipes like a laddu and chikki or like that. You go and have it in a very little quantity. Don't have it in a everyday like a snack.
Okay. By using cold pressed oil, we can't do deep fry. As it overflows, how you cook a puri?
It doesn't overflow. If you feel so, add little oil. It actually doesn't overflow.
Yeah, true. Uh,
Just raisins
just
and
raisin and dates is okay for daily.
nothing is okay for daily, especially we know as an Ayurvedic doctors. I mean, each season has a different food. Each prakriti has a different food. Let's not stick on to one same food for the every day or whole year. Let's
My
let us follow some. I mean, different as per prakriti and season also, and let us teach the same also for the people surrounding us.
My personal question is, can we nowadays youngsters they are using the whey protein and creatinine? How far it is safe?
See, the people, those who are using that whey protein or some other protein powder, they don't know the value of our, traditional proteins like a dal, cereals that what we are using. So once we give the knowledge of our traditional protein, they will start to use it.
No, after saying the traditional this thing also they won't agree. Even my own son, he won't agree. You don't know anything, they'll tell directly to us. In fact, you should also use some protein, they'll tell. How to convince in such conditions, I wanted to know. And along with that, even creatinine also.
Say, whey protein, why they use? Because they do gym or to build up the muscle. Whey protein is an extraction of the curd. When we go for, I mean, any extraction, you just ask them to look for the digestion process. There are two types. One is it goes to the intestine, that is a metabolic thing. One more is the portal digestion. Directly, it goes to the portal system. Any of the medicines, why we tell not to use antibiotics or any allopathy medicines, because it goes to the portal system. Any extracts directly goes for the portal system. Once it goes to portal system, it is a burden on liver, and the excreta is directly taken by the kidney. It's a burden on kidney. So liver and kidney disorders in the long term, it is always on the higher side. Just ask him to read the portal system of digestion. When we take it as a food, as a whole food, example buttermilk, instead of having whey protein, buttermilk 2 to 3 glass or 1 liter per day. When we go to it, it goes through the digestive system. Whatever is required, the body absorbs. Remaining goes through the urinary system, then the excreta system. The different systems are involved and it goes out. So that is a better way of reducing the burden on liver and kidney. Even Ayurvedic, so many medicines now they are adding extraction. We had one company, we don't remember the name, where they had added for thyroxine 0.25 mg something they had added. What is the use of giving Ayurveda medicines when they're adding for Kanchanara Gugula or Shiva Gutika, if they're adding a thyroxine? It's a no use. So let us not promote such extract medicines even in Ayurveda also. Extraction directly gives burden on liver and kidney. That's why now so many hepatomegaly cases, grade 1, grade 2, they don't treat at all. When it goes to grade 3, grade 4, they tell liver transplant.
Thank you. What is Badam Gond, which was mentioned in diet chart?
It is a gone. It is an extract of the tree. I don't remember the tree name. But when you go for the this one dry fruit store, you get two types of gone. Nowadays dry fruit store they sell it. It is easily available. Before in Grandi Angle we used to search for that. So one gone is used for the Bananti, that is post delivery. That is the heat. It generates heat to reduce vata. Use that in laddu and all. One more is a badam gond. If you ask them, they will give. It is a little whitish and pinkish color. It is like a jelly, natural jelly. We can soak in the overnight. Morning it becomes like a jelly. Even for kids, we can tell them jelly and we can give them. Even we can do like especially in summer. Soak their sharbat along with this jelly and little bit kamakasturi bija on the top. It just looks like some mocktail, a different one, but which is a healthy. That also we can do it.
Broken wheat can be used.
Occasionally okay, but again, not we tell it as a whole wheat only.
For muscle building in teens, what protein and how much per day do you suggest?
Like we usually suggest, traditional laddus, that protein laddus, green gram laddu, all those different cereals laddus comes. Usually in traditional that, Ashtami laddu was the famous actually. If you are consuming every day 2 laddu as a snack, that much of protein is enough actually. And if you are consuming every day, that dal and dosa, idli, our breakfast, even chitrana also that we will put the tadka, urad dal, right? That much of protein is enough for us.
And promote physical activity in children. Just don't leave because they're children. Just don't ignore them. Let's promote from the childhood. That is the best way to build muscle along with this traditional laddus.
Nowadays, eating fruits from market is how much safe, ma'am?
That we have to find the safer fruits. That's it. We cannot tell that which market is safer. And even all ingredient, every ingredient is now addictive and they are using some adulterant, everything. So we have to pick the natural one, how much is possible.
If
Actually,
we say,
I love grapes. No, I love grapes. Last year, usually in Bangalore it comes earlier, right? I will not eat until the season comes. When the Grishma Ritu comes only, I will eat the grapes and I waited. By the time Grishma Ritu came, all grapes was vanished from the market. It was not there at all. So this time I thought, let me buy because the fruit I like. But everywhere it is sour. Already the pitta is on higher side. If we eat that sour, what happens? It's up to you to select the good ones. We are really, we can't tell which it is really good or not.
if we say medicine or extracts should not enter directly into portal system, even our many researchers, Rasaushadis enter portal system directly, being Sukshma. How can we explain the science?
These are purified with the herbal juices, any Rasaushadha preparations. It is not directly given. So all those purification methods are, our ancestors, whatever they have done, they have completely taken care of each and everything. So processing, like 7 times processing, 14 times processing, 21 times, all this processing will make sure that it does not give burden on any liver or kidney and directly cures or treats the disease.
Upavasa,
We need not question on any of our ancient medicines. It is such beautifully created. We can just close our eyes and just prescribe. It will work.
Yeah, right. Upavasa, do you advise to cancer patients on auspicious days?
If they're willing to want to do that, we can do. It depends upon the person and condition. They are able to do. If there is no so much symptoms is involved, then definitely they can do it.
How many kgs weight reduction per month is safer side?
For a cancer patient or a healthy patient?
Healthy patient, they might be asking.
1 or 2 kgs per month, not more than that. But of course, in Panchakarma, it happens 3 to 4 kgs. That is okay. But apart from that, 1 or 2 kgs per month.
Thank you. Thank you, doctors, for wonderful explanations and questionnaires this time. One more question. Drinking milk daily. Please explain, ma'am. Already, I think, explained.
Drinking milk, again, which milk, that also comes because nowadays even Nandini milk is getting so many changes, fortified and so many things. Not only Nandini, even other packet milks. If it is a organic milk, it is really good, but again, not during Kapha Prakriti or not adding with some Horlicks or Boost or some other powder. Healthy. Having it milk with any Indian spices, adding it with pepper or turmeric or any other Indian spices are healthy, either in the morning or it is a growing, or depending on the person, it can be even in the night. But if you are going for a packet milks, we usually advise, not to go for the milk.
Okay. Raised hand, I think.
Oh, namaste, madam.
Namaste.
Underweight in RA patients food, madam.
Underweight.
RA patients, rheumatoid
So,
arthritis.
right. So again, it depends upon the person that we have to take a complete consultation of those person, that what they are eating from morning to evening. Then we have to change that. And obviously in rheumatoid arthritis, the AMA will be accumulated. That we have to eliminate the AMA, then only we can decide.
Madam, long term Amavata will reduce the weight, madam.
Yes, water related, right? It will reduce, and the deformity of the bones, everything happens.
Sarcopenia is common, no, madam?
Yes.
Okay. Thank you, madam.
I think we can take one or two questions and we'll end up. Anyone? Dr. Suma?
Hello. Hi, ma'am. It was a wonderful session. And I have a doubt regarding milk and salt. And we know that this is Viruddha Ahara. And is it only Samyoga Viruddha, or you told that we cannot take milk just after food? We need to give a 2 hours gap because food has been get into different process after we eat, and that will be totally a different. And just want to clear that is it we should not mix milk with salt before eating. That is called Samyoga Virda. And how you justify that, ma'am? Just after taking a food, you cannot have a milk as it mixes with the salt.
Now our question is, like, why do you mix milk and salt? Which preparation?
Yeah, in many things like smoothies also they add some salts, and in some customs they take milk, rice, and with some salts.
It is not a custom.
They do take.
I
It
know.
is not a luck custom. They used to take that.
And that is the reason they get diseases also. It is an incompatible. Either Samyoga or Rashirudha, anything, it is an incompatible. Let's not mix. Let's not promote that. Let us teach that.
See, whenever they say that they are using the milk, right? So just substitute that with the coconut milk for the kheer or any sweet preparation, right? If you are using, even for the curry, if you want to prepare salt, if you want to put the salt in that, they can replace it with the coconut milk. Actually, traditionally, coconut milk is the healthier option, not the milk. Milk, like Dr. told, that you have to use with the Indian spices like a ginger or jeera, like that, with the Indian spices only you have to use. You are not supposed to put any salt in that.
Not
Yeah, I
only
know, ma'am. That is Viruddha only, mixing salt and milk. My question is, you told that 2 hours gap to be given before taking a milk after a food. How you justify that? Means after taking a food, it will go into a different process, right? It will
Yes.
not just directly mix into a salt.
No. See, like fruit and milk is incompatible. So if you eat fruit today, you will not drink milk till tomorrow. Yeah, it can happen, right? It is we have to give time for its digestion process. We know milk, when we drink, it doesn't come out as milk only. The processing changes will take into a different action. So once it changes, minimum it requires from our stomach to enter the intestine system and to change, it will take some time. So by around that, we have told 2 hours. So the 2 hours gap, what happens 2 hours gap? Sometimes they forget also, or sometimes they take also, the gap will be there so that it just enters the other food enters the intestine, and that food, if the thing will be changed, the vipakas or everything will be changed after that. Then they can have it.
Okay, ma'am. Thank you.
Hello, madam. One more question, madam.
Huh?
In Amavata, pain and stiffness starts from the midnight to early morning. How can can we avoid this by food, madam?
Actually, Amavata, that's what approach same way, like how we told alla dosha, prakriti, pratyondanu tagonde hogbeku. So when it is increasing the midnight, see that what factors are increasing, or fan hakota idara increase ಆಗ್ತಿದ್ಯಾ, or long gap, andre ಊಟ ಮಾಡಿ long gap ಕೊಟ್ಟು if they are sleeping after a long time, again that increases vata. Those things if you avoid, then automatically it will be corrected. Till then it is there, then in the midnight they can have just a glass of milk with any spice and they can drink and they can sleep, so that it reduces. But positive factors na first avoid ಮಾಡಲೇಬೇಕು.
ಅಮಾವಾತದಲ್ಲಿ ರಾತ್ರಿ ಹೊತ್ತು ಹಾಲು ತಗೊಳ್ಬಾರ್ದಲ್ಲ ಮೇಡಮ್?
ಅಂದ್ರೆ ತಗೋಬಾರ್ದು, ಮೀನ್ ಪಾಸಿಟಿವ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಇಫ್ ಯು ಅವಾಯ್ಡ್ ಇಟ್ ಇಸ್ ಫೈನ್. ಇಲ್ಲ ಅಂದ್ರೆ ಟೈಮ್ ಮೂಮೆಂಟ್ ಗೆ ಅದನ್ನ ಕಡಿಮೆ ಮಾಡಕ್ಕೋಸ್ಕರ ಯೂಶಲಿ ಹೇಳ್ತೀವಿ ಮಧ್ಯ ಆಸ್ ಲೈಕ್ ಪೇನ್ ಕಿಲ್ಲರ್ ವಿ ಟೆಲ್ ದೆಮ್.
ಅದೇ ಮಾಡರ್ನ್ ಪ್ರಕಾರ ತಗೊಂಡ್ರೆ ಸೈಟೋಕೈನಿಸ್ ಇದು ರಿಲೀಸ್ ಆಗತ್ತೆ, ಅದನ್ನ ಅವಾಯ್ಡ್ ಮಾಡ್ಬೇಕು ಅಂತ ಇರೋದಲ್ಲ
ಅದ್
ಮೇಡಮ್?
ಯಾಕೆ ರಿಲೀಸ್ ಆಗುತ್ತೆ? ಬಿಕಾಸ್ ದೇ ಆರ್ ಅವೇಕನಿಂಗ್ ಆಫ್ಟರ್ 9:30 ಅವ್ರು ಎದ್ದಿದಾಗ ರಿಲೀಸ್ ಆಗುತ್ತೆ. ಆಸ್ ದೆಮ್ ಟು ಸ್ಲೀಪ್ ಬಿಫೋರ್ 9:30, ಇಟ್ ವಿಲ್ ನಾಟ್ ಇನ್ಕ್ರೀಸ್.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್.
Thank you. Can you send balanced diet chart for obesity? Dr. Udaya asking.
I think with these approaches, all can prepare the diet charts.
Okay. Thank you. Can Langana be advised in cancer patients? As recently I read an article of autophagy to kill cancer cells. What's your opinion on Langana in cancer?
I think similar to was what we told, the same thing. Depends on the patient, we can add.
Okay. What's your opinion on Panchamrita? Where will we mix banana, milk, curd and
all together incompatible, but Panchamrita when we give in the temple, we just have 1/4 spoon, not more than that. So having more than that is creates incompatibility. Having that much is like a inducing vaccine. Like they induce virus to our body, right? It's like a vaccine. It works like a vaccine, but not on every day, not on more than that much amount.
Does the coconut oil and ghee, coconut milk rise a lipid profile? While treating dyslipidemia, should we still, these are not, milk with the turmeric is a right combination. All three questions are there.
Okay. That for the lipid profile also, when the increased cholesterol also, we give the Snehapana, right? Snehapana and Virechana, everything that we do. So then it indicates that definitely ghee doesn't increases the lipid profile. And there is a, like in our, most of the seminars that we usually tell the history of the this lipid profile, that how they scared the people earlier days. In 1956, I think Ansel Key, that he invested one study, and he told that, that whatever the things, fatty acid that we eat, it will increases our cholesterol and it will be end up in the chronic heart diseases. That's how that we stopped using our traditional fatty acids. This traditional fatty acid, ghee and coconut oil, coconut milk, everything is a healthier option. If we are using it in the limited quantity, definitely there is no harm in it.
Milk with the turmeric. Is
Yeah,
it
that's the right combination that we can use it. Like everyone knows that milk is little bit kapha. To reduce the kapha, that any kind of our Indian spices that we can use it actually.
Your options on early dinner, how early should it be before sleep?
2 to 2.5 hours, but sleeping time should be 9:30. Do not extend dinner time because you're sleeping late.
For North Indians, those who are used to chapati, not used to rice, what can be done here to counsel them? As when we tell to reduce the frequency, they say from childhood we eat only rotis or chapatis.
They can eat, we need not reduce for them, but they also eat dal chawal, they also eat khichdi, dal khichdi, all those. We can ask them to increase those instead of telling them rice sambar or rice rasam. So those things they will increase. They can have chapatis and also in between godhi dosas, that also we can tell them to consume. But for them, for such people, especially in North India, they're staying in Bangalore, we should ask them to increase their physical activity. If they are in North India only, is fine. But when they are here, they have to increase the physical activity.
Thank you so much, both of you, for patience answering. And now we'll go for the vote of thanks by Dr. One, just a minute. Subhashini. Over to you, Dr. Subhashini.
Yeah, thank you, Dr. Geeta. It was really a brainstorming and eye-opening session of the day. So I would like to thank Dr. Rekha and Dr. Archana for such a wonderful session. And usually there is a misconception about Patya in Ayurveda. Patients say Ayurveda andre Patya, Patya andre Ayurveda anta. But when we advise them the Patya in this manner, definitely they don't say Ayurveda andre Patya anta. They understand that Patya is for their disease, which we are all doing as of now. And one more thing about the ethics to be followed by the doctors, it was really a good thing, which is a need for the hour of. We usually some doctors do these type of mistakes. So, and it is like it is a suggestion or some kind of a lesson to the junior doctors who practice in future, who practice pure Ayurveda in future. And I would also like to thank RAAOUS team and the founder of RAAOUS, Dr. Sakuntala Madam, for giving such a very good platform to enhance our knowledge regarding Ayurveda. And the last but not the least, I would like to thank all the Vaidyas who participated. It was more than 100 plus, which made this webinar very successful. So thank you one and all.
Thank you, Dr. Subhashini. Thank you once again, Dr. Rekha and Dr. Archana. It was wonderful presentation. We would like to see you